So when I was monitoring, I really didn't get a chance to go into depth of like what all the surgical monitoring equipment was because I was focused on monitoring the patient. So I decided to make like a video afterwards explaining what everything does. So the pulse oximeter is the piece of equipment that measures the oxygen saturation of the blood and tissue perfusion. It also measures the pulse rate. It gives you the hemoglobin that can carry the oxygen levels. It uses wavelengths of red and infrared light to measure the oxygen saturation and give you the PR. The one that we have at our clinic is a lingual pulse oximeter, and it can be placed on the tongue, on the pinna, on between the toe webbing, external genitalia, which would include the vulva or the prepuce of a male or female dog, and then anywhere without hair. The normal range is going to be above 95%, but ideally it would be between 89 and 100%. The second piece of equipment is the capnometer. This measures the carbon dioxide that's in an exhaled breath. So that's going to be actually attached to the endotracheal tube and the line at my clinic. It's going to measure your respirations and your quality of the respirations, and it's expressed in millimeters of mercury. And the normal range for that is 35 to 45 millimeters of mercury. Another piece of equipment that we have at our clinic, at my clinic, is the blood pressure. So that's how that's going to do is it's going to make sure that your blood pressure stays above, like, in a good range, to make sure that the organs are getting the tissue perfusion that they require so you don't get organ damage. This is going to be applied to either the forelimb or the tail. It needs to cover 40% of the limb or tail. If you hold it vertically to the limb to ensure that you're going to get the proper reading on it. So the normal range is your MAP needs to be above 60 millimeters of mercury, and in a sedated patient, your SAP needs to be between 90 to 160 millimeters of mercury, and your DAP needs between 50 and 90 millimeters of mercury. Another piece of equipment that we have at the clinic is the ECG. So that's going to be placed, the white side goes on the right, and the black one goes on the left, and the it goes front, and then the red one goes on the back, and that's remembered by smoke over fire. So that's going to give you your heartbeats and show you if there's any like normal sinus arrhythmias, normal sinus rhythm, sinus arrhythmias, things like that. The ideally is going to be between 60 and 150 beats per minute. And then for a large dog, really ideally between 60 and 140. For a small dog, it's going to be 70 to 160. And for a cat, it's going to be 120 to 180. And I'm going to let the doctor know if it drops below 100 or if it goes above 200. And then for our respirations, which it's also going to give us, we're going to be looking ideally between 8 and 20, and I'm going to report if the respirations go below 6 or above 20. One of the things that we have at my clinic is the ability to give a breath using the bag. So that's one thing that we have at my clinic. One thing we don't have at my clinic, which I wish we did, was an esophageal stethoscope, and this is going to be measured intraoperatively. It's placed in the esophagus next to the heart, and if it's not placed right next to it, you're just going to get lung sounds. It's not something that we carry at my clinic. I've never actually seen one in person. I've only seen them in the books. But yeah, that's how you're going to look at your monitoring equipment and ensure that everything's working, that your patient's under normal parameters, and if anything's abnormal, I'm going to alert the doctor because it's her patient or her medical license. So yeah.